Cannabis goes by many names. Pot, dope, kind bud, grass, marijuana. And for years there has been a negative stigma attached to this plant. But that's exactly what it is, a plant. Something that grows from the ground. And it is not inherently evil like some people believe. It is the use or misuse of it that is good or bad, not the plant itself. I think that it is time we look past all that we have been told about the dangers of marijuana and see that it actually has legitimate medical uses. And I believe that if it was something developed by scientists instead of a Schedule I drug, it would already be legal for medical use. I would first like to start off with a little history of the use and regulation of marijuana. For thousands of years, marijuana has been used as herbal medication and for intoxication. But modern science is much different than that of antiquity, and things have changed. William Randolph Hearst of the San Francisco Examiner revolutionized American journalism by using bold headlines and sensational topics to get the reader's attention. He's kind of the original Ron Burgundy. Well, William Randolph Hearst ran a smear campaign about the horrors and evils of marijuana to protect his interest in the timber industry, since hemp was poised to be a cheap replacement. As a result, by 1931, in America, 29 states had prohibited its use for non-medical purposes. Then, in 1937, the federal government first got involved with the Marijuana Tax Act, which required anyone producing, distributing, or using marijuana for medical purposes to register and pay a tax, which also effectively prohibited non-medical use of the drug. So then in the late 1960s, there was a large increase in marijuana use in adolescents and young adults, which prompted the government to take even harsher action. As a Schedule I drug, that means that A, has no medical use, and B, a large potential for abuse. But as I will explain to you now, recent studies have shown that marijuana actually has medical uses, and according to a 1997 Institute of Medicine study, there were upwards of 30 potential uses. Shortly after the passage of the Controlled Substances Act, a UCLA researcher discovered the first medical use of marijuana. While researching methods which the police could use to tell if someone had been smoking marijuana, he inadvertently discovered that the use of marijuana helps reduce pressure in the eye, which helps people who are suffering from glaucoma, a group of diseases which are the second leading cause of blindness. These findings were able to help save many glaucoma patients from blindness. This development also allowed for more research to be done, which led to even more discoveries about the medical benefits of marijuana. Soon afterwards, when chemotherapy was just starting to be used, some patients who were also marijuana smokers realized that its use helped reduce the nausea that is often caused by chemotherapy. And even though modern science has created better drugs to help combat the nausea, it is still one of the many positive uses of marijuana. Marijuana has also been known to help decrease chronic pain, specifically that caused by cancer. Studies have shown that for a chronic pain, a small dose of marijuana has comparable results to that of a medium dose of codeine, which is a relatively weak painkiller. The patients using marijuana, however, also showed improved mood, increased well-being, and less anxiety. One unexpected benefit of marijuana is the increase of appetite. And many AIDS patients develop something called wasting syndrome, which is the loss of over 10% body weight due to fever and other effects. For these people, the loss of as little 5% body weight is associated with reduced survival. Many cancer patients lose a lot of weight as well, and this can be caused by the tumor itself or a side effect of chemotherapy. The use of marijuana causes appetite stimulation, and this is from neurogenesis of brain cells that say, hey, I'm hungry, and can help many of those people gain back some of the weight that they have lost. One of the main obstacles of medical marijuana is not the effects of it, but the connection between medical use and illegal marijuana use. Many people think that by making marijuana legal for medical use, it would open the floodgates and would be a step in the legalization of all marijuana use. I don't necessarily think that would be a bad thing, but I believe that they are two completely different issues, just like the legal medical use of painkillers, such as OxyContin and morphine, and their illegal abuse are completely different. Another issue is that it would cause an increase in recreational marijuana use, but if medical marijuana was as strictly regulated as that of other medications, I see that no reason that its use would increase. In conclusion, I think that marijuana is a viable medicine. There may be drugs out there that do a better job combating specific symptoms, but the benefits of marijuana, while used in conjunction with other treatment options, could be very beneficial. The use of it must be carefully considered for every person, just like that of any other medication. But I think that it should at least be an option. My grandmother was diagnosed with cancer 5 years ago, and if you ask her, the combination of appetite stimulation, pain relief, and reduction of nausea has helped her stay alive and live as full of life as she can for these past 5 years. So, thank you.